Howard Pollick.
Okay, go ahead, sir.
I'm at UCSF. Your question is with the baby issue.
There was a concern that the level of fluoridation was too high for babies to drink, and
Right, and the American Academy of Pediatrics recommends breastfeeding for infants. However, the majority of children are not breastfed, and ever since time began, almost there's been alternatives to breastfeeding. So we recognize that with increasing knowledge and science base in terms of fluoride intake from all sources, that young infants, when they are receiving powdered infant formula or formula that's concentrated and has to be diluted with water, that young babies will receive a lot of water. And some will receive higher than what is considered to be the tolerable upper intake, whereby after in excess of that, there's a chance of developing dental fluorosis, white streaking of the teeth, as those teeth are developing. And so this guidance was issued, as you've heard, to provide information so that risk can be balanced with the risk for tooth decay when considering what kind of feeding practices should be used for infants. If infants are using the ready-to-feed formula that doesn't need dilution, then there's no issue. So that when using an infant formula that needs to be diluted, we're recommending using distilled water that is available at stores.
So you'd recommend distilled water, which has no chemicals in it?
That's correct.
Okay, excellent. Thank you. That's a very direct question.
Can I follow up? So there are, I guess what I'm not understanding is, so there are, in fact, interim guidelines on new science that was discovered stating that for infants who are not breastfed and rely primarily on, for their nutritional needs, on water that is fluoridated to mix their formulas, that there is an increased risk of fluorosis at certain levels.
Correct.
Okay. And I believe one of the doctors, I don't remember which one said this, that that there will be some sort of a notification, and I'm not sure how this is going to be accomplished for those young people or whomever might be using fluoride supplements, that those fluoride supplements should be halted once the water is fluoridated. Is that an accurate statement?
Currently, lots of children are prescribed fluoride supplements in the San Diego area because the fluoride does not have sufficient fluoride. The water does not have sufficient fluoride in it. We're not talking about the infants now, because infants under this age of 6 months, we don't recommend any fluoride supplement. And the supplement is in addition to what they would be getting otherwise. So depending upon the age of the child, from let's say 6 months to 3 years, 3 years to 6 years of age, over 6 years of age, there's a different dose that's recommended because of the increasing size of the child in terms of fluoride supplement.
But so it's a correct statement to say that if the water is fluoridated, that those people or persons, whomever they might be and whatever ages they may be, will be advised to either decrease or eliminate the fluoride supplements from their activities.
That's correct.
Okay.
If the water is fluoridated, we recommend no additional supplements.
Okay. And if that information does not get out to the people who need to have it, what are the potential health risks associated with taking fluoride supplements as well as drinking fluoridated water?
The only consequence would be that they would get potentially double the fluoride dose that is recommended, with an increasing risk for getting dental fluorosis. It's still protective against tooth decay, but we want to also prevent dental fluorosis.
All right, and so the primary risk associated with too much fluoride in young folks or young people is a fluorosis.
That's correct.
Which is I mean, essentially,
Fluorosis is not a disease. It's a condition that doesn't change once the teeth are developed, and it can affect the appearance of the teeth. But we're not talking about severe dental fluorosis that would be pitting or brown staining of the teeth. But for some people, it is noticeable, and so we want to guard against that.
Okay, and so, thank you. For Metropolitan Water...
Could I just follow up on that, too? Just
Please.
Are these prescription, these fluoride supplements are by prescription?
That's correct.
So wouldn't you tell the dentist not to prescribe it anymore? Wouldn't that be how you handle it?
That's right. And
not a
so all
matter
the
that-
dentists have to
yeah.
be informed.
So it's not a matter that moms aren't going to get the word because you're going to tell the dentist.
Good,
So they're not going to prescribe it
Well,
anymore.
there are some, come October the 1st, some of the prescriptions will
Already
be out there.
Okay. All right. So you'd want to work on both.
Right.
Okay.
So let me, I didn't know that. So in order for a child to receive fluoride supplements, you need a prescription from a
That's correct.
physician.
From a physician or
However-
dentist,
Okay. So someone with a medical degree of some sort,
medical dental degree.
medical or dental degree. But if you put it in someone's water, there is no prescription needed.
That's right. There's no prescription needed because it's been determined to be safe and effective through thorough research. And it affects everybody.
So why couldn't I just go buy it in the store over the counter?
You
why
can,
would I
you
need
can
to write-
purchase fluoridated water from stores
No, I
when
mean
it's
whatever
available.
those supplements
supplement.
are, the things that you prescribe to kids.
Well, because it's
Why
in
would I
pill
need a
form, or it's in a pill form or a drop form, and there is the risk, if it's available over the counter, that it's not being taken appropriately. And so, with the prescribing practices, the prescriber, the doctor, the dentist, pediatrician, is obliged to actually talk with the person to say, this is how much you take, these are the consequences of not taking it. And so that's the distinction between over-the-counter and prescription.
So there must be some issue if you have too much fluoride.
Yeah.
Okay, so I guess that's the issue. And then the question is for Met, on the cost to fluoridate at your treatment plants. What is the estimated cost to fluoridate your supplies per acre foot of water treated?
I will quote an estimate because we can't give the exact cost because we haven't started fluoridating. We have some estimates that have been done over the years, but the number I've been quoting, and again it's an estimate, it's a range. It's slightly less than $2 an acre foot.
Okay, so your cost per acre foot is slightly less than $2.
The estimated operation and maintenance cost, yes.
All right. And so as part of that, when the County Water Authority purchases water from you, do you or will you increase your costs per acre foot of water to offset the costs that you will be using for the fluoridation of our water?
It's my understanding, and I'm not a rate structure expert, we can get one, but we have certain components of our treatment, and the normal cost of treating water is part of that structure. This is viewed as part of that normal cost. We do other treatment. We use other treatment techniques like ozone, chlorine,
Right.
other additives.
And
this is part of that quote-unquote treatment cost.
Right, I understand it's part of that
But to
treatment
specifically
cost. Yeah.
answer your question, that cost will not be passed along to the County Water Authority or to any of our 26 member agencies. It's incorporated as part of our normal treatment cost.
So there's no addition, you say that there's an additional cost to treat the water, but that you're just going to absorb those costs. And so there will
correct.
be no increased costs to County Water Authority for any of your treatment. In other words, the costs of treating the water are not going to be increasing by Met at all
And I'm
for
trying.
your treatment costs, right?
When we go online with this, the County Water Authority will not see a incremental increase as a result of our startup. It's incorporated as part of our normal treatment costs.
So in fact, there will be increased costs because the cost of your treatment will go up, and as the cost of water treatment go up, those costs will be passed on to Met. or onto County Water Authority.
And I want to be careful not to be misquoted or characterized.
I'm just trying to understand if there's an increased cost for treating.
There is a cost associated with this, and as I mentioned, the approximate cost is about $2
per acre foot.
Per acre foot. But again, that's as part of we have other treatment costs, and when chemicals go up, that cost goes up as well. And
Okay. So if you had to add chemicals, and the cost of the chemicals are roughly $2 per acre foot, then my guess is your treatment costs for the water treatment go up.
That's correct.
All right, simple, thank you.